Leanna, can you tell us about the clinical research job market? What does it look like? Is it really competitive? Is it hard to get positions in this?
It is actually a very different industry to get into. It seems to me like when it started, it's kind of secretive, but once you know it's there, there's a huge need. A lot of the CRAs right now, they're called CRAs because not everyone's a nurse. A lot of the CRAs now they don't know the patient chart backgrounds. They don't know how to actually look at a chart. So there's a lot of discrepancies. There's a lot of problems. And there's a lot of work, and they're getting burnt out. So there is a huge opportunity for new CNRAs to get involved with this industry and be actually really good at it, and actually be able to give this data to the pharmaceutical companies so they can actually pass it on to the FDA and approve these medications for patients.
Okay, and it seems like you have created a course that's helping to forge a whole new industry for nurses, like that CNRA, because there is the CRA position where non-nurses can do this, but the CNRA is taking the nurses who have this knowledge and background and really just pushing that forward. So what do you think some of the bigger benefits are of having a nurse in this position, and do you see this as being well received by the industry?
I do. It's not something that the industry really talks about, but there's definitely an argument there that nurses are qualified to do this position. We are chart reviewers by heart. We were trained to look at charts. We are trained to see symptoms. And a lot of this data that's being collected are symptom management, symptom items they call adverse events, but this is what they train the non-nurses to look for in charts, where we already know how to get that information. So the data from a nurse should be a lot cleaner than the data from somebody with a different kind of a degree or different training or background. And yes, they could be trained, but we're natural. It's natural for us to go for the patient, to look at the chart looking at the patient themselves. It's taught to other people, but we're natural at it. So there's a lot of argument there. There's a lot of it's great to know that we can actually bring this to nurses so that nurses can bring this to pharma companies and they can get the data they need. So there's a good chance that this will be welcomed into the industry.
Yeah, and we're pretty biased because we just think that nurses are better at everything. So, all right, thank you.